Good evening, everyone. I'm Justine Joliver Galase. I am going to discuss about other health impaired, and that is diabetes mellitus. Diabetes mellitus is a condition that occurs when the body can't use glucose or a type of sugar normally. Glucose is the main source of energy for the body cells. The level of glucose in the blood are controlled by a hormone called insulin, which is made by the pancreas. Diabetes is a lifelong disease and is a group of metabolic disorder characterized by high levels of sugar in blood. It is caused due to deficiency of insulin or resistance to insulin or both. Insulin is secreted by blood cells of pancreas to control blood sugar levels. Blurry visions, excess thirst, fatigue, frequent urination, hunger, weight loss are some of the symptoms commonly seen in the diabetic patients. The hormone insulin moves sugar from the blood into your cells to be stored or used for energy. Untreated high blood sugar from diabetes can damage your nerves, eyes, kidneys, and other organs. So there are a few different types of diabetes. First is type 1 diabetes. Type 1 diabetes is an autoimmune disease. The immune system attacks and destroys cells in the pancreas, where insulin is made. It's unclear what causes this attack. If you have type 1 diabetes, your immune system has attacked the insulin producing beta cells in your pancreas. This means you can't make enough of your own insulin and need to replace it through injections or a pump. But insulin doesn't treat the underlying cause of type 1 diabetes. So the second is type 2 diabetes. It occurs when your body becomes resistant to insulin and sugar builds up in your blood. So when you have type 2 diabetes, your fat, liver, and muscle cells do not respond correctly to insulin. This is called insulin resistance. As a result, blood sugar does not get into these cells to be stored for energy. When sugar cannot enter cells, a high level of sugar builds up in the blood. The next is prediabetes. Prediabetes occurs when your blood sugar is higher than normal but it's not high enough for a diagnosis of type 2 diabetes. So what causes prediabetes? Insulin is a hormone made by your pancreas that acts like a key to let blood sugar into cells for use as energy. If you have prediabetes, the cells in your body don't respond normally to insulin. Your pancreas makes more insulin to try to get cells to respond. Eventually, your pancreas can keep up and your blood sugar rises, setting the stage for prediabetes and type 2 diabetes down the road. Lastly, gestational diabetes is a high blood sugar during pregnancy. Insulin blocking hormones produced by the placenta cause this type of diabetes. During pregnancy, your body makes more hormones and goes through all other changes, such as weight gain. These changes cause your body's cells to use insulin less effectively, a condition called insulin resistance. Insulin resistance increases your body's need for insulin. All pregnant women have some insulin resistance during late pregnancy. However, some women have insulin resistance even before they get pregnant. They start pregnancy with an increased need for insulin and are more likely to have gestational diabetes. Gestational diabetes typically doesn't have any symptoms. Your medical history and whether you have any risk factors may suggest to your doctor that you could have gestational diabetes, but you'll need to be tested to know for sure. It's important to be tested for gestational diabetes so you can begin treatment to protect your health and your baby's health. Gestational diabetes usually develops around the 24th week of pregnancy, so you'll probably be tested between 24 and 28 weeks. If you are at higher risk for gestational diabetes, your doctor may test you earlier, blood sugar that's higher than normal early in your pregnancy may indicate you have type 1 or type 2 diabetes rather than gestational diabetes. Before you get pregnant, you may be able to prevent gestational diabetes by losing weight if you are overweight and getting regularly physical activity. Don't try to lose weight if you are already pregnant. You'll need to gain some weight but not too quickly for your baby to be healthy. Talk to your doctor about how much weight you should gain for a healthy pregnancy. That's it, my report. Thank you for listening.